Children can't learn when they are having a trauma response. The most reasonable and academically oriented and trained psychologists, pediatricians, therapists, teachers, and parents will all agree with this. When a child is having a trauma response, which is essentially that their subconscious survival brain is perceiving they're in danger, under life threat, they actually can't process information rationally. They can't understand cause and effect. They're not able to even necessarily communicate or understand auditory input effectively, just like anybody else who was in a car crash, held up at gunpoint, or who had suffered neglect and abuse. Here is where the logic breaks down, however, for many professionals and some parents. They cannot suspend disbelief around the fact that their neurodivergent child on a subconscious level is neurocepting, danger or life threat, because they can't see anything happening. They can't see that external indicator, and there's a degree of needing to trust and believe that the neuroception, the subconscious perception of threat, can be activated by lots of things that are not visible to the outside. Like, for example, an autistic child who's having a fight-flight response to sensory input like fluorescent lights and a lot of noise, or like a pathologically demand avoidant child who is constantly perceiving threat on a subconscious level whenever they don't have autonomy, freedom, and choice. It's the same mechanism. In both cases, neurodivergent children and traumatized children, in both cases, their nervous systems are being set off. And yet, the parenting strategies and the evidence-based therapeutic strategies are still focusing on acting as if they're in their frontal lobe where they can actually learn. So this logic, to me, is very clear. It's brain science. And so I would like to invite anyone watching this to consider that maybe the right approach is to treat these, quote, behavioral responses as a trauma response, to be supported and prevented over the long term with accommodations, instead of reacting to it as if it's under the kid's conscious control and trying to make them not have the trauma response.